I'm Jennifer Denton, and today I'm going to talk about, for my evidence-based project, individualized education, and is it important? So I appreciate everybody coming today. At the end, I'll have a little quiz and a survey. So if you would, please fill that out for me and give it to me before you leave. Thank you. So today I'm going to talk about the education, and I'm focusing on coronary artery bypass graft, or CABG as we like to say. So before I talk about all that, I want to talk about heart disease and work our way to that. So incident, heart disease is the leading cause of death in men and women. Coronary heart disease is the most common type of heart disease. It is the leading cause for the racial and ethnic group in the heart disease category. Heart disease costs the United States about $207 billion each year. Some risk factors include high blood pressure, high cholesterol, and smoking. Other medical conditions of lifestyle choices that can also put you at high risk are diabetes, which is also poor diet, physical inactivity, and excessive alcohol abuse. So here's kind of a picture of the heart, and it's describing the coronary arteries. You have your right coronary artery, your left, your marginal branches. So this is why it's so important to eat healthy, because all these veins or arteries you see affect how the heart's going to pump. It affects how the blood flow is going to get to your body, etc. So it's important that we take care of our bodies. Coronary artery bypass surgery, again, like I said, is also called a CABG, or open heart surgery. This topic interests me because I work on a cardiac intensive care floor, so we take care of patients who just had recent open heart surgery. So I was kind of curious I would see some of the same patients come through, or I might see them on the roster and be like, I wonder what happened. I wonder what the incidence is of why these people are being readmitted. So I kind of wanted to delve into that discussion or question. So what does a CABG surgery do, or what's the point? So it treats blocked arteries. You can have 1 to 2 to 3, I've seen 5 at the most, grafts being done on a patient. So what's the reasons that people have a CABG done? Well, it's the most common and effective procedure. It improves blood flow to the heart. It relieves chest pain, which is what you see people coming in for, is the chest pain, short of breath, because it's not getting that perfusion. It reduces the risk of heart attack, and it improves the ability of physical education. A lot of times people are saying they can only take a couple steps with, and then they're exhausted. So this helps increase that physical activity for these patients. So this kind of is a picture of what they do. They take a vein graft, usually from the leg, maybe in a couple places depending on how many numbers, and they graft them into that blocked artery. They kind of make another passageway for the heart to be able to perfuse that artery. Some complications is that there's common sites of infection. You have the respiratory tract, surgical sites. You see 27%. The highest one was the respiratory. The catheter or devices, and I'll kind of go into those. Complications occur in 5 to 25% of cases. The increased mortality is about more than 5 times, and prolonged recovery. The reason for the respiratory tract is a lot of times they've had, they're intubated, and then when they get extubated, they don't feel like taking a deep breath because they may have chest tubes, or they don't feel like moving, so they have a common cause of like pneumonia or atelectasis. Surgical sites, excuse me, is they'll have those staples and they're not cleaning them, so they'll come back for the surgical sites, or IVs that may cause some kind of infection. So my PICO question, in post-coronary artery bypass patients, how does individualized education follow after discharge compared to education only during the hospital stay affect readmissions to complications within the first 3 months? So what's the purpose of education? It's the increased performance and self-management behaviors following discharge. Types of education. You have verbal, you have written, you have videos, you have teach back, and we know the most effective one later we'll also talk about is going to be your teach back. Challenges. Same education material for all patients. We're giving everybody the same individual education, but I may not be suffering from diabetes, or I may not be suffering from the same, I might not be a smoker, kind of etc. Patients are overwhelmed with the information. They just had major surgery and we're giving them all this information, so sometimes it's a little overwhelming, and then so they're not able to retain that information. So that's a challenge. Readmissions. Facts regarding readmissions is the outcomes that patient have open heart surgery within the first 30 days of discharge are 85% of them get readmitted within the 30-day window. Some top reasons for readmissions is your post-operative infections, heart failure, or other complications. Maybe they're not taking care of themselves and not following the guidelines that we've given them. Then 1 in every 5 patients are readmitted, which is a very high number. Individualized education, do we need it? Learning needs are defined in the study as the topical areas of interest perceived by the individual that's important to them to learn. So what the patient finds important, they're going to learn it. If it's something they don't see that's obtaining to them, it's going to just go right over their head. Providing the patient with the individualized education is increase the opportunity for the individual to react positively. So if we're taking the time and breaking it down for them, to their level, to what they need, it shows that they positively are receiving that information. The teach-back method has been shown to decrease readmissions. It's important that we look at each patient as an individual and try not to lump education and assuming one size fits all. The prevention. What I've learned through the study, and the studies have shown, cardiology appointments set up the day of discharge helps decrease readmission. That helps them when they get home, they don't have to worry about setting up that appointment. Excuse me. Individualized education and follow-up calls to the patient. Sorry about the cold. Conclusion. Readmission rates are too high. Patients are too overwhelmed to retain all the information during their stay. Appointments need to be rescheduled day of discharge. And individual education needs to be implemented. Excuse me. Follow-up calls need to be made to the patient to address any questions that they may have. They may have gotten home and I think, I should have asked this, I should have asked this. Teach them to go home and kind of write a note, take notes, do questions. That way, now that their mind's clear, they can be able to think clearly, and they have, if they have questions, you can go ahead and help answer them. Brainstorming ideas. I want to take this time to kind of ask you and pick your brains. Ways to make sure teaching is being provided. What can we do that maybe your hospital is not doing or another facility is not doing that may work? Ideas for teaching patients on the individualized level. Some people have only completed like high school, or some not even all of high school. So what are some ideas? Staff available for follow-up calls. So what are your ideas? I would love to hear them. Here are my references. So now we're going to take time to discuss and come up with some brainstorming ideas, and don't forget to fill out the quiz. Thank you.